Well, I think this is a good time to go ahead and get started. Hello, everyone, and welcome to our Leadership Connection series. Today we have Michael Peterson, who has served in New England as a healthcare executive for many, many years. He's actually served on our board of directors for Northern New England chapter of ACHE for many, many years. So there is so much that we have to talk about today to learn from his career journey. But I will tell you, Michael, when I shared the post that we were going to be interviewing you today, what I noticed was that people seem to be really interested in what it takes to lead a critical access hospital. So I wanted to start out by asking you to share a little bit about your organization, and then we can go on to your career journey. So please tell me a little bit about the hospital that you lead.
Well, thank you very much, Tiffany, and good evening, everybody. I'm sorry I can't see everyone's faces, but I'll just pretend. Uh, Androscoggin Valley Hospital is a critical access hospital, as Tiffany said, up in Berlin, New Hampshire. It is, as per the regs, a 25-bed hospital. However, it's rather unique because it was originally built in the mid 70s when the city of Berlin alone had 30,000 people in it. This was when the mills were at their peak. And so the hospital is actually quite large. It's 4 stories. And so when I came to AVH from where I came to was before at another critical access hospital, I was looking around at the size of the place. It was actually built as a 94-bed facility. So it's a pretty significant piece of property. And again, it was really built to serve um, that community at that size at that time. I think we have our interlopers back.
I know, I see that. I'm going to turn off the chat. Sorry, guys, I'm going to be turning off the chat. Please go ahead.
And then we basically, the legacy of that is we actually have a significant amount of specialty services that you wouldn't normally think of when it comes to providing services from a critical access hospital. And that's again because it was such a larger community, a larger organization. We have a lot of tenured and long-term providers. We are one of 3 critical access hospitals in North Country Healthcare, which is, to our best of our knowledge, still the only integrated healthcare system in the country that is not partnered with a tertiary medical center somewhere in its system. And so the beauty of that is we actually all speak the same language. And we don't have to explain to anybody what a cost report is and why it's important to us. We basically cover the entire northern region of New Hampshire, including all of Coos County. We serve parts of northern Carroll and northern Grafton counties, as well as some of eastern Vermont and western Maine. So our primary service area now is roughly about 30,000 people, the same that was just in Berlin. And the secondary service area with our home health and hospice agency that's a part of the health system goes as far south and serves down as far as Plymouth. So it's a fairly sizable geographic space with roughly 45,000 souls. So it's transportation geography can be sometimes difficult, and the weather also gets in the way sometimes for just simple transports and so forth. So we have collectively at North Country Healthcare about 1,100 employees. AVH alone is about 450 employees and 76 active medical staff. So we're the largest of the 3 hospitals, and we are pretty much the primary specialty service and specialty surgical hospital of the 3 critical access hospitals. We don't have primary care. where there's a few an FQHC in our town that we partner and collaborate with very closely. They provide the primary care base because, frankly, it would make sense to carve up the pie, and nobody would really be at productivity. So we depend on them for our primary care, and we serve them with acute med surge and specialty services, diagnostics, and operative services as well. Anything specific you want to hear that I left out, Tiffany?
No, I think that's really interesting. So I've worked at a number of critical access hospitals, but I've never seen that partnership with the FQHC, which is
Yeah.
an organization that I work for now. So I know how important that work is. So I think that was very smart of you to really create that collaborative relationship with your community partners. And
Yeah.
I'm glad to see that it's successful. It makes so much sense.
Yeah,
So,
and historically, I know that sometimes FQHCs and hospitals can sometimes butt heads, but
yeah.
realistically, I think it was an opportunity. When I joined ABH, I was a brand new CEO to the region. The incoming CEO of the FQHC was also brand new. So we didn't have any
Mhm.
baggage or anything like that. We sat down and said, how can we collaborate together so we're, creating some sort of mutually beneficial relationship? And we have. We've done a number of interesting collaborations over the years. I can get into any of them if you want to.
Yeah,
That has really led to a partnership versus a headbutting contest.
right.
Yeah, so we're not aligned, formally or officially, because of course,
Mhm.
there's all those regs about that. But
Right.
partnering, it's easy. I meet with the CEO of the FQHC every month,
Yeah,
and ad hoc we can pick up the phone and call each other anytime. They actually rent space in our building for primary care. So as far as the
nice.
community is concerned, there's a lot of gray area around. Well, is this CCFHS or AVH or whatever? But we are
Hmm.
two entities for sure. Yeah.
But it sounds very patient-centered, the fact that you're letting them have space in your building, so that's convenient for the patient. So I
Yeah.
really love that. So now, I've known you for many, many years, but I really don't know about your career journey. So I'd like to hear about how you got interested in healthcare, kind of what your career trajectory has been, and how it led to you being where you are now.
Thank you. Well, I guess I was the beneficiary. I always knew I was going to do something in healthcare.
Hmm.
Um, I was inspired at a very early age by my father,
Yeah.
who was a healthcare CEO in a community hospital in northern Maine for
Oh,
27 years, and my mom, who was a lifelong nurse. She was a nurse for 30 years and then became a lactation consultant. And I knew very early on, too, I could never do what she does. I'm not, I don't have that gene, I guess, and I have the utmost respect for people who can lay hands on patients and take care of them. I thought I might be a clinician at some point, but uh, I was a ski racer in high school, and
mhm.
one day, as teenage boys will do, they're sometimes going places they shouldn't be, and I was skiing in the woods with some teammates between races, and I fell and broke my back.
Oh, wow.
And we were close to the hospital where my father worked, and I was getting my CT scans and wheeled off. And the technician, because he knew who I was, said, "Would you like to, see your images?" I said, "Sure." So I rolled around and took a look, and there it was: L4, L5, compression fractures of both, herniated disc, and I almost passed out. So I said,
Wow.
just looking at my own images, there was no way I was going to make it through gross anatomy. So I decided then and there, I knew healthcare was meaningful work, and I knew it made a difference. I was 14 years old following my dad around the hospital. I didn't really even know what he did at the time, but I knew by how he interacted with people, the staff, visitors, the patients, it was meaningful. Yeah, and so I decided I want to do that. Maybe I can't help patients directly, but I can help the ones who do. And so I started consuming everything I could about healthcare leadership and just project management and so forth. I got my undergraduate degree at University of Maine at Orono in public health, and it really clicked when I took a healthcare capital budgeting class. And
Wow.
I got to write a whole paper on developing an innovative strategy around resurrecting an ambulance service. And
Oh.
it didn't feel like work. It didn't feel like class. It was fun. It was interesting. So I just started consuming everything I could from there. Ended up going to Huston College for my master's degree in science of business and healthcare administration.
Mhm.
And I knew that's what I wanted to do. My first job actually in the hospital was in 1988. I was in plant operations. I had a technical degree in architectural drafting, so I was working in plant and just drawing out, lines all over onion skins and helping with the renovations and so forth. But I also got to work with the plant operations guys, and I
Okay.
went through the whole hospital and got exposed to everything that way.
Wow.
So it was an eye opener that I could see that there were so many different ways to contribute to delivering the patient care and that mission to the community. So
Mhm.
I knew I would find some niche that kind of sang to me. Um, I interned at Eastern Maine Medical Center and marketing when I was in college. And then when I graduated from college, I started working at the Acadia Hospital, which was then brand new. That was the start of Eastern Maine Healthcare Systems at the time, 1992.
Okay.
And Acadia is a behavioral health and psychiatric facility and
Mhm.
substance abuse acute facility. So I was in the patient access department or registration. So I learned very quickly that without the right schooling and background, that was not for me. I was literally signing people in at their lowest point. They were either going through active detox or in the middle of a manic episode or a psychotic break. It's a tough job. And it
Yeah.
really gave me a lot of respect and empathy for the people who can do that job every day to take care of those members of our community. But a few years into it, I said, I'm going to get burned out if I don't find something else. Well, I've always been interested in innovation, and I presented my boss at that time an idea because we were actually keeping track of patients on paper before they actually became patients, so they weren't in our medical record yet. So I
Mhm.
pitched this idea of creating a database to just store that stuff electronically and make it more easy than finding papers all the time. She said, run with it. So I took a few days, connected with some folks in the IT department, and we developed a database that they actually had been using up until just a few years ago. But that got the attention of the CIO. And he said,
Mhm.
of the system, and he said, we're standing this hospital up still. Would you like to be our new IT director? And so, sure, early 20s by then, and I was, yeah, let's go. So I got my first chance to write my own job description, and so I stood up the IT department at Katy Hospital, working for the CIO of the system and the COO of the hospital at that time.
Mhm.
And through that process, it gave me a lot of exposure to, just policies and writing things and starting to hire staff and, the basics of healthcare leadership. I was still in my master's program at that time. And
Mhm.
when I was done with that, the CIO asked me, hey, look, we've got something big happening in a couple of years. And I'd like to, I know you're into project management and some of that stuff from your courses. It's this little thing called Y2K. And would you like to lead the system project to get us through Y2K? So I said, sure, never been
Wow.
done. And there's something to be said for having an absolute deadline for something. So here I
Yeah.
am, 28 years old. I had a 400-person staff and a fairly large budget all of a sudden. But that was my first exposure to working across the system. So multiple hospitals, multiple communities, and multiple leadership groups and boards and so forth. That was really exciting. And I really enjoyed seeing the symbiotic kind of conversations that happen when, great ideas can come from anywhere. And the little hospital staff is supporting the big hospital and they're receptive to it and the vice versa. It was really an
Mhm.
exciting time. But it was the definition of a dead end job. So in 2000, I had to do something different. And so I had
Mhm.
attracted some attention at Eastern Maine Medical Center, and
Mhm.
I was asked to be the director of imaging and surgical services.
Interesting.
That was right after I graduated my master's, and I had then six clinical department directors who had come up through the clinical ranks, and part of my job was to help teach them how to do a budget and interpret, a responsibility report and you name it, some of the basics that I had the background in my education that they just didn't have access to. That
Okay.
gave me my first exposure to teaching. And I really enjoyed learning about what they do clinically, but helping them to grow as well. So it really kind of resonated with me. Unfortunately,
Mhm.
though, Eastern Maine Medical Center is a big place. I mean, 426 beds. I was used to, Acadia Hospital, a very warm and fuzzy kind of culture environment.
Mhm.
And at that time, it's gotten far better since, but at that time, people honestly sometimes didn't even acknowledge each other in the hallway when they were passing each other by. So it really didn't fit
Right.
for me. So I spent about a year and a half at EMMC and then was approached by the VP of marketing at this system and said, "Hey, look, we've got this new thing going on with Cerner. It's called IQ Health. It's basically a patient portal. Would you be interested in helping us stand up one of those?" And we then, this was too early 2000s. I got to be the first national user group chair for Cerner IQ Health. And we
Wow.
were actually the first integrated health system in the country to offer a patient portal. And I was working with Winona, Minnesota. There was some other UPMC and so forth, some real initiative leaders. But here I was, this kid from Maine, working alongside with these guys and really trying to define the future of what patient health communication can be. I found
Mhm.
myself translating a lot between marketing, finance, and IT, which was really kind of
Mhm.
neat. But then about 2005, it started to feel like I was losing some fire in my belly. I was getting too far away from the patients, too far away
Mhm.
from originally what I wanted to do was what my dad did. And
Yeah.
so one of my early mentors at the time said, look, a lot of CIOs don't become CEOs. So if you're on the
Mhm.
track to be a CIO, that's fine. That's great. We can use you. But, um, that's not going to, scratch that itch if you really want to get closer to the bedside. So I took a jump at that point. And with his direction, they had just created a VP of Ancillary Support Services at a critical access hospital in the system. He says, I think you
Mhm.
should apply for that. And I did. And I spent 10 years at Sebastopol Valley Hospital, part of EMH at that time. And I was the VP of Ancillary Support. I picked up diagnostics. I picked up specialty services and physician practices. I eventually became the CAO/CIO. Uh,
Yeah.
and I was also then ultimately became the COO. So
Mhm.
at one point, I said, well, it's time to throw my hat in for the CEO role, but there are only so many hospitals in Maine. So I had to
Right.
kind of look around. I knew I wanted to stay in Northern New England. It's just where I was raised in Aroostook County. I knew that those were the kind of values that I wanted in a community and ultimately in an organization. My wife and I were raising two young boys at the time. We want them to grow up in a community that has those same sense of values.
Mhm.
And so I had to kind of look in a limited space. And I was approached by the founder, one of the founding members of North Country Healthcare, Warren West, who said, "Hey, we've got this new idea. We got four critical access hospitals coming together. We're going to stand up a new system." That was intriguing to me. Again, innovative, new, no baggage. None of these folks had, these three of the four had regularly collaborated together through the Dartmouth Health Initiative. So they
Yeah.
were used to collaborating. But all of us in the North Country, we were similar culture, similar agenda, similar, motivation and drive to serve people in rural communities. And so it was
Mhm.
a great opportunity. So I dove in.
Yeah.
And I've been at ABH now since for the past 10 years. And so that's kind of the abbreviated version of a long story. But so IT, project management, I'm not a finance guy and I'm not clinical. But that's how I came to be.
Wow. So you kind of alluded to this earlier, but definitely as someone who has worked in critical access hospitals all over the country, I mean, you name it, I've probably worked there. And there is definitely a unique skill set that's required for working in a critical access hospital. So I would like for you to dig a little deeper and share, like, I feel like, it's the emotional intelligence, it's really becoming part of the community. And so I would just like for you to share, like, what are some of those unique leadership skills that you feel have helped you be successful in leading a critical access hospital?
Yeah, absolutely. I think, and this goes, it's going to benefit any hospital leader, any healthcare leader, is just focusing on the relationships, right? This is all about relationships. In a smaller community, most critical access hospitals are the biggest employer in town. They're a huge part of the economic driver for that region. So that, in addition to providing the medical services and care to the community that they depend on, it's that essential, that it's usually if not the biggest, one of the biggest payrolls in the community. So it's going to drive inflow and so forth. And frankly, people look for a few different things when they're looking to relocate their families somewhere. How are the schools? What are the amenities? And some may look at the crime rate, but they always look at healthcare. What's the healthcare like? So it's that important to be to the community, when you're a critical access hospital. It's also about making sure you build the relationships with your community partners, because
Yeah.
there's so many fewer resources to draw from in a rural setting. Most of these critical access are in pretty far-flung areas of the country, and they have to be innovative and nimble, because we can't afford to just kind of take things slow, or we won't make it. So being very creative on how to allocate scarce resources and how to leverage partnerships and collaboration across the community and with other partners, even other hospitals that aren't part of your system, and leverage that so that you can serve your community well. Another skill that I really enjoy, and this is why this really sings to me in terms of how large we are. I think community critical access hospitals, we usually are, very capable organizations, and we're big enough to cure, but we're small enough still to care. I can tell you the names of the dogs of my chief anesthetist. I do know the people. I get to spend the time to understand who they are, what makes them tick, where they came from, why are they even here, and their backstory. So it gives me a chance with 450 employees. I can do that. With
Mhm.
4,000 employees, not so likely. So that's why I like this size, really, this kind of organization. Plus, I grew up and the traffic drives me wild. Now driving to Portland gives me hives. But so being creative with solutions and ideas. I always often say to people, I'm not an adrenaline junkie, but I do appreciate the scrutiny that we get in critical access hospitals. Our constituents, our patients are right there. And the decisions we make today, the actions we take or don't take today, will have an immediate impact on somebody right away. And we'll see that. We might actually even be standing in the checkout line at the grocery store with that person tomorrow. So every one of us can touch a patient, touch a patient's life and make a difference. Uh,
Mhm.
but it's the feedback is immediate. So we have to be creative. We have to be nimble, because again, we're the only game in town for the most part. So if we get something wrong, it's gonna affect the whole community. And it's not just, if we screw up a transition to a new EMR, or screw up a process change or something like that. They can't just go to the hospital down the street. We're it. So we have a lot of extra pressure, and dealing with that is crucial. Also, we got to be good multitaskers. I mean, there's a lot of us
Yes.
wear a lot of hats in a critical
Mhm.
access hospital. We have fewer resources to draw upon, fewer people to delegate to. So we really have to understand the depth of the operation. And with all those things said, and no offense to any of the maybe folks from larger organizations, it's a tough gig.
Yeah.
To be able to manage that, our margins are razor thin, and
Right.
yeah, it's percentage wise, they may look the same as a number of other big balance sheets and P&Ls, but dollars
Mhm.
wise, it can evaporate really quick if we do something poorly. Um,
Right.
Many of our providers are one-ofs. So lose
Mhm.
one provider, you're looking at either locums or closing a service line. So making sure that we are effective in our recruiting and ensuring that it's a good fit is another nuance, I think. So rambled there for a bit. I apologize, but
No, no. You touched on a couple of things that I want to dig a little deeper into.
sure.
So, first, I want to talk about the relationships.
Hmm.
And, I have worked in communities where, I go to church with people that report directly to me. And, those relationships are some that I will hold dear to my heart forever, my whole life long.
Yes.
But then there have been times where I have to redirect or potentially discipline the same person that I lovingly go to church with.
Yep.
And so, what advice would you give to someone as they're trying to navigate, that relationship that is so rewarding, but then also when there's a misstep or there needs to be some course correction, navigating that balance between friend versus boss or
Yeah.
leader of the organization.
And that's really tough when there's only so many candidates from the community or a pool. It's a narrower pool, if you will, or a shallower pool to draw
Yeah.
talent from. So in many cases, especially if you end up leading an organization where you've been for a while, yeah,
Yeah.
you've built relationships, built friendships. In some cases, even maybe you've gone to high school with
Right.
some folks that you're now working with or leading, and that can carry through. I mean, honestly, it doesn't surprise me. And when I first got to AVH, and I'll come back to the point you wanted me to talk to, but I first got to AVH, and there was these two people were just butting heads constantly. They were
Yeah.
both directors, and they just couldn't see eye to eye on anything. They weren't communicating very well. And finally, I had to sit them down and say, "Okay, tell me. Let's clear the air. What's going on?" It turns out that somebody was still upset from somebody who it was a prom night kind of thing, and boyfriends were stolen and
Oh
fingers were pointed.
no.
It carried forward. 20
Yeah.
years had gone
Wow.
by, and they still had a grudge. So it does happen. Um, the advice I would have is you got to be able to effectively separate personal and business, and that is really tough. I specifically decided I was not going to live in the community where the hospital was. I needed
Mhm.
that little bit of insulation so that
Mm.
if I needed to, I was out in the community and just spending personal time on my own, I'm less likely to run into a lot of staff that work for me. I still live close enough to the hospital; it happens, but you have to be able to be aware of your surroundings and be aware of what's being said and heard and so forth. And I've always lived by the rules. You don't say anything out loud in public that you don't want to see on the paper, the front page of the paper the next day. Um, but most of us, we spend a lot of our waking hours at work. It's not possible to not make friends. It's not expected you must, but things go much smoother when you are friends. But yeah, I have actually had experience with that where I had to not only discipline but terminate somebody that
Yeah.
for a friend I've known and built a relationship with for years.
Mhm.
It's something you have to be able to do because that was my duty. I have a fiduciary responsibility to look out for the mission of the organization, and when that friendship becomes too familiar, sometimes
Mhm.
you got to know when you're going to be taken advantage of, and you cannot have double standards. And
That's
so
right.
it is very tough. I actually got additional help to support that in terms of just providing an insulation, a level of, like a bubble
Yes,
to give a little separation there.
that's right.
And I've also always, when I am, spending time with
Mhm.
somebody outside of work, we don't talk about work. This is
Right.
not the forum for it. So that gives that separation as well. But setting expectations up front as well,
Mhm.
it's much easier at the beginning of a relationship to say, hey, look, I enjoy
Right.
playing golf with you, or I enjoy, mountain biking with you. But just so you know, when we're doing that, we're not dealing with work. This is a break. This is our ability. We just happen to like the same thing. So please
Mhm.
don't bring work stuff here. I need a break. You
Right.
need a break. But we also don't want to give any misperception of impropriety or favoritism or anything like that.
Mhm.
That could hurt us both. I found that very effective in setting the expectations up front, and it makes it easier down the road if something does feel like it's blurring that line a little bit. Say, hold up,
Right.
we've talked about this. We just need to make sure that we respect those boundaries.
Yeah. And just to add to what you said, just for those who may not have had this experience, I have also worked at a critical access hospital where we brought in outside legal counsel, outside investigators to address issues where we needed to have that distance from the situation and really have it be a very neutral assessment of the situation. So thank you for mentioning that because I don't think people often think about the need to sometimes bring someone from the outside to have a fresh eyes and perspective there. Now, you talked about this a little bit, talking about recruitment
Mm-hmm.
in rural New England. That is challenging. Um, I can think about when you're working in the rural parts of New England, the age of the employees, the skill mix, the education, and, retention. And then I would love to know what have been some of your strategies because, I've tried to like create career pathways with community colleges for employees to like skill them up to the
Mm-hmm.
jobs that you need for them to do. I've tried a number of different strategies, so I'd love to hear some of the things that you have done to really create that talent pool that you need to run your organization.
Okay, yeah, absolutely. One of the first things is very ensuring that we have good retention strategies first and foremost, because recruitment gets easier if there's fewer holes to fill.
Right.
So making sure that the talent has the tools, the skills, and the support they need to really do their job to their very best and take care of the patients. I've always been taught, and I believe this too. You take care of the people, they'll take care of the patients for you.
Mhm.
So that's where I always start with recruitment is retention,
Mhm.
because people who are considering moving to a location and are being recruited, they'll be looking at, what's the dynamic? How do people act when they're here on for a site interview, or, and they ask questions. Is this a good place to work? Well, you always want the staff who are there to answer that question favorably. It's you got to get them on the showroom floor. And if your staff sell the company itself, then you don't have to recruit as hard. So it's really about making sure they're going to be your best supporters. When recruiting, though, we are very selective in terms of making sure it's going to be a good fit culturally. I'll usually look. We always ask the question: what's your tie to the Northeast, or what's your
Mhm.
tie to rural? Why are you interested in coming to work in a community like this? It does have its um, challenges and sometimes disadvantages because the resources are fewer and farther between. But obviously, we've got a lot to sell too. We've got, Coos County in New Hampshire is actually, the cleanest water in the state. It's the cleanest air in the state. It's a great place to raise kids. It's great for outdoor activities. So we look for the things that might hook the whole family, not just the candidate, but how are they going to be relocating to the North Country of New Hampshire, and will they stick around for a while? Because the other thing the communities up here expect is not this revolving door of new faces and churn of especially providers. So we really take our time to make sure that it's going to be a good fit. They wouldn't even be on the property if we didn't think they were clinically or technically skilled enough to fill the job. But we
Right.
do take that extra time to make sure it not only is going to be a good fit for the candidate, but their family, if they have one. Um,
Mhm.
so yeah, that's one of the tactics. Another is to make sure that they're supported once they get here, and talk about yes, this may be rural. It may be kind of seem like out of the way, but we have networks. We have opportunities to go to a conference or go into the cities and connect with other people. I always encourage, of course, the leaders to get involved in ACHE and make sure that they are able to connect with not only other rural folks, because problems, solutions can come from everywhere, but also connect with some of the larger organizations across, so we can make sure that they stay contemporary and they feel professionally rewarded as well. So it's about making sure you hook them, make sure they fit, and then keep them around for a while. We've got actually our vacancy rate is half the national average with that strategy. And our turnover rate continues to drop. Our time to fill rate has improved with those strategies as well. So, yet it does take more time in some cases to find the right fit. But I think it's a lot less costly, not only in terms of total recruitment money spent, but morale
Right.
and just the churn to take the time to find the best fit first and then keep them for a longer period of time so you don't have to keep rotating.
Yeah. So you mentioned ACHE, and we
Mm-hmm.
haven't talked very much about how ACHE has impacted your career trajectory. And first of all, how you came to become a member.
Yep.
What was it about ACHE that made you want to stay and do more? And then I'd love to hear about how you got involved in the governance structure.
Sure. So again, I credit my dad for leading me to the ACHE. He's now a life fellow, and he was. This was 1992. I was a student affiliate or student member. Um, and I went to Congress back in 1992, and it was an overwhelming, experience for a kid who was just trying to get into. Okay, I don't know exactly what I want to do in healthcare, but I know it's going to be something in leadership. How can I make the most difference, right? But that
Mm,
exposed me to so many different tracks. It was seriously overwhelming. So as soon as I graduated, I became a member, and I knew that that was going to be the way I was going to be able to, continued education, build networks and relationships and mentoring. I mean, that was another real value throughout my career is having both informal and formal mentors through either the college or my own home system. Because I want to learn, and I know I've got every day I can keep learning. I just told the group this today, 38 years in the industry, I'm still learning new things every day. So
that's right.
it's one of those opportunities that I knew the college was going to be able to provide for me. So back in those days too, they still had the CHE before fellow. I'm just a
Hmm.
little bit competitive. And funny story, my dad and I became fellows in the same year in 2007.
No
So I was
way.
encouraged by my then mentor, who was a fellow CEO of my father's. He said, "Go get it before he does." So we studied, we took the test the same year and became fellows the same year. Unfortunately, neither of us got to go to Congress in March. That would have been really special. But so yeah, I've been a fellow now for 19 years. And
Wow.
I just knew that, continuing to keep up my credits, this is, the college has always been a part of my career path. I see it as an obligation to help expose new leaders to the college and all that can offer, because I know it's going to benefit them, their organization, and ultimately the patients they take care of. So I've always been an advocate for that. And then governance, honestly, one of the gentlemen on this call actually approached me and said, hey, we could use some help at the chapter board, and would you be interested? And of course, I'm not going to say no to a colleague and a friend. So yeah, I
Hmm.
think it's 10 or 12 years ago now I started working with the chapter board. That gave me another level of networking, just because it was much more of a microcosm. Maine, New Hampshire, Vermont, you can really get to
Hmm.
know people. And before that I was going to clusters and Congress and so forth. It's so big. So
Yeah.
being able to be a part of the governance structure and kind of help set the path for what we can deliver to the members in our region, that was
Hmm.
yet another kind of quantum leap forward in terms of networking and relationship building locally. So, because I know I have always known I want to do my whole career in Northern New England. It's just this
Um,
is where it means the most to me. That answer
yeah.
your question? Okay.
Absolutely. So now you've mentioned mentors a couple of
Mm.
times. So I would love to hear about maybe a mentor that was special to you, someone who really made a difference. What was it about the way that they mentored you that really helped advance your career? And of course, I'm sure that you also mentor others. So I'd love to hear about some of those special mentors in your life.
Great, sure. So I've mentioned my dad a number of times. That was,
Yes.
obviously an informal mentorship, and having that sounding board at my beck and call realistically was a great asset. But more
Hmm.
formally than that, one of the executives at Eastern Maine Healthcare Systems kind of recognized that I was on this track, and kind of took me under his wing. So Ken Hughes was the former EVP of the system back then, and he suggested, gave me a lot of insight as to uh, course tracks to take and maybe conferences to go to. And he was just a down to earth, straight shooting guy. And he really took the time to explain the why behind the what. Because,
That's
here's this guy in one of the big offices on the fifth floor, and he's taken the time to talk to me and really genuinely seemed interested in making sure that I understood the rationale behind some of the big decisions that were happening. So I really appreciated him taking that time. Jack
Mhm.
May was a CEO at Sebastian Valley Hospital, and when I got there, he was the guy that kind of brought me back to the closer to operations path.
Mhm.
And he's another, again, just straight shooting guy. He always called him as he saw him, and he had a slightly different perspective, but I could relate to him. And he was approachable, and it was very easy to ask tough questions and ask about, well, what if this, what if that? And he had come from retail before he got
Oh.
into healthcare leadership, so he had some other kind of background and perspective. That's one of the things I've learned is you really want to find formal and informal mentors who come from different perspectives.
Mhm.
Then you can learn from their lens and try and amalgamate that into kind of an approach that works for you. Another a great mentor, Jerry Whalen, was the VP of marketing at Eastern Maine Healthcare Systems, and he and I just connected. He was my boss too, so for a while, so we spent a lot of time talking together about how things, not just the work, but the strategy and thinking about future and how we can innovate to provide better care. And more recently, I've been leaning a lot on colleagues from around the chapter. And, Mr. Wright here, who's with us, we spend a lot of time just, it's an objective outside perspective that,
Mhm.
without getting into confidential stuff, but it's great to be able to have this network of resources who may have just gone through something similar or has a different approach or an idea. I remember at one point I had to let go of a physician who was very, very productive, very well liked in the community, but not
Yeah.
very productive at all, and wasn't
Right.
really interested in changing that. Um,
Yeah.
and before I took any action, I called my friend Mr. Wright and said, "Well, what am I missing? What should I be thinking about?" And he
Yeah.
asked me, "Okay, where are the camps? Where's this going to ripple in the community? And what do you think?"
Right.
So I can think about getting in front of stuff like that. So I learned an awful lot from others that were going through the process with me um,
Mhm.
about the same time. Mentoring, I have really enjoyed mentoring as well. Back when I became a fellow, you still had to do either a thesis and a project, or you could mentor.
Mhm.
So I chose the mentorship route, and I officially, took on a mentee and did that for the year. It was it was fantastic. I feel like I got more out of it than the mentee ever did. And that's been my experience ever since is, every time I get a chance to formally mentor someone, I take away just as much, if not more than they do. Because
Mhm.
again, new perspective and it's a great way to test some of the stuff that we're talking about. And it's changed my outlook on things. Currently, I'm a mentor in the AHA Next Gen Fellowship Program.
Yeah.
That's the same thing. However, it's a little bit of an imposter syndrome because the person I'm mentoring has actually got a much bigger job than I do. But it's exciting and it's always an opportunity to learn from. So I learn from my mentees as much as I learn from former mentors. But
Absolutely. So, as I think about healthcare right now, we are facing so many challenges, and I always like to ask, what keeps you up at night? What do you feel like are the threats that you are trying to navigate that could potentially, change the way that you can provide healthcare to your community? Like, what are the things that are top of mind for you right now?
well, probably the first thing that I'm going to say is the first thing on everybody's mind right now is our government seems to be actively working to kill our industry. Uh,
Hmm.
and it is really a challenge with the ever ongoing shift of the market to favor either big pharma, big tech, the payer community, as opposed to
Right.
providers. I think that's going to be the biggest challenge for us for a while. Uh,
Yeah.
and just trying to make sure that we're solvent so that we
Mhm.
can continue to be here for our communities.
Yeah.
And that's absolutely one of the things that keeps me up at night. The other, honestly, is the erosion of trust of the scientific, the people
Mhm.
in the scientific community.
Yes,
We're the experts in delivering healthcare, but it
that's
seems
right.
like since the mid days of the pandemic, that erosion has really exacerbated, and we get a lot. We're not as trusted a resource or a voice and support in the community. That's really made it difficult when
Yeah.
folks are out there pitching whatever remedy that we know is not going to work for them. But we're challenged and just trying to keep up with the social media disinformation and misinformation that's out there. It makes it challenging. Um, Another, I think, is we're going to be challenged for probably another decade. Workforce, workforce, workforce. Just to making sure
Mhm.
that we all have the resources we need, just to take care of the community that continues to age, and we don't seem to embrace, as our society anyway, this concept of let's get into well care and try and keep ourselves out of episodic sick care.
Mhm.
That's just we're not there as a society yet, so we're gonna have to think about how we use care teams as opposed to, I can't even remember the stat, but it was pretty alarming when I heard how many primary care physicians were going to be short in the next 10 years. And nursing, I've heard about the nursing shortage since that first trip to Congress in 1992.
Yes.
It's this constant right now, midterm, long-term strategy to keep those workforce pipelines full. Because AI is going to be a very great complement to healthcare, but it will never replace, the people that deliver the care. So that's what the big three that keep me up at night.
I'm glad that you mentioned AI. Have you thought about implementing or are you currently implementing AI in your healthcare system?
Absolutely, a number of different ways, and AI is just the latest buzzword for some of the stuff we've been using for years. And
Right.
in our imaging systems, for example, and detecting wave differences in EKGs and so forth. Algorithms have been used for a while, but now it's got
Hmm.
a sexy new name, and that's got all the buzz. But yes, we are using ambient listening technology for our providers who are
Nice.
now saying they're able to see an extra 12 patients a week and still go home at the same time, a reasonable time, less pajama time.
You're right. I've heard of that pajama time. Yep.
Multiple surgeons have said, yeah, this is a game changer. So we're
Wow.
absolutely piloting it. I think we started with 12 primary care providers and a number six or eight surgeons. It didn't really work well for us for behavioral health with that module. It's just a different kind of
Mm.
structure, but it's definitely making a difference already in the early stages. We're into that about year and a half, almost 2 years into that project. And then we're using AI, where it makes sense in the back office stuff. We're now
Mhm.
introducing AI predictive analytics in our revenue cycle work. So absolutely, we need to be doing that because the insurance carrier market, they're way ahead of us in using
Yeah,
AI to help deny the claims. We need to get
right.
that and fight fire with fire. So, yeah, we have to embrace wherever AI can help complement and make us more efficient. Now, personally, I use AI all the time. ChatGPT helps me put together an executive summary of my board report in about 3 minutes or less, where it used to take me, a half an hour to type that all out. It's a huge time saver just on kind of the administrative tasks. So,
Right.
but yeah, we're getting more and more creative, I think, as an industry about how we can apply AI. I think it's going to be
Hmm.
a game changer for precision medicine and
Hmm.
using genomics and so forth to really kind of, yeah, that's over our pay grade in terms of critical access hospitals. But the research centers, I'm sure it's going to be, we're not even going to recognize it in a few years. So, uh,
Yeah,
yeah.
it's amazing. And it's happening all so quickly, so quickly. So, one last question that I want to ask you, because we put this leadership series together for people who might not have a solid mentor. And so, my one last question for you is, what advice would you give to someone who is, trying to rise through the ranks to ultimately become a CEO someday? Like, what are some of the key things that you would advise them to do to help them progressively get to that top spot?
Okay, so I'll start with a couple of formal things and tools and resources that are out there. Um, One of
Yeah.
them is there's a self-assessment tool that's available through the ACHE website. If you go onto the
Mm.
website and just do that self-assessment, it tells you where you're strong and it tells you where your derailers are and where your gaps may be. That allows you to kind of focus your energy and fill in
Yes.
the gaps where an objective metric or an objective tool describes not what you think. Because when I first went through it, it was like, oh, I thought I was really strong in this. Well, not so much, it turns out. So focus your time and energy on what you need to fill in for gaps. So that tool's out there. It's a free resource to any member, and certainly it helped me early in my days. Um, and then I would absolutely take advantage of any kind of formal network of mentors that you can get engaged in, either through ACHE, the AHA now has them, some other associations have them as well. But a formal mentor program is definitely something that would be an advantage. Most of them is outside of your own organization. That's key to
Right.
have that slight distance relationship so you can share things objectively, get unbiased feedback, not have to worry about, sharing something was, I screwed this up big time today. You're not going to want to share
Yeah.
that with someone in your vertical. But to safely, ask the hard questions and maybe get told some hard answers too. Someone outside your organization probably won't pull punches when they are calling you out, and that's what you need to be able
Yeah.
to grow informally. Yeah, connect with others, connect with, reach out to your peers and colleagues who are on the same track. um, Take part in groups or going to conferences and go to the networking sessions, meet people and find out what they're doing. um, I also would encourage you to find the informal mentors, and
Mhm.
ask them, would you mind spending some time with me? Maybe I need help on financial acumen. I can't tell a profit and loss statement from a balance sheet. Go talk to your CFO. You know, I will bet
Yeah.
anyone, most of us are in healthcare because we like to help people by nature. When you approach somebody like that and say, hey, I want to understand, um, I'll bet they'll make time for you and they'll be happy to teach and share with you. This is what this means and this is why this is important and so forth. The questions that, unless you came up through those ranks, you don't get exposure to that.
Yes.
So having the courage to be vulnerable and ask the hard questions, and it's okay. Not any of us are born with this stuff. But
Mhm.
so watch those and find those leaders who you can approach even within your own system and ask them for some of their time. I'll bet they'll give it to you. Finally, I'll share, you can observe everybody. If you're noticing how people behave, how they make decisions,
Mhm.
Some are going to be learning from the good, some are learning from the bad. I mean, I had a mentor who didn't know she was a mentor. I watched her, how she spent her days and spent most of her time covering her tracks. I learned back then, I don't want to be doing that. I think honesty is the best policy because you never have to remember what you told to somebody. It was the truth. You just
That's
remember the
right.
truth. That's all you have to remember. But you can learn from poor performers too. Just remember what those mistakes were and try not
Right.
to repeat those.
That's
So that's what I'd share kind of informally.
wow. Well, I guess one last question that I want to ask you, and this is more so about family.
Mhm.
Uh, being the CEO of an organization is a really tough job. It's very stressful. But your family is also very important. And so, are there any special things that you do to try and make sure that you keep your family a priority?
Absolutely. I'm very, very lucky. My proudest accomplishment are my kids. And I, we've, my wife and I have specifically decided we're going to try and get them involved and engaged in things, activities that we can do as a family together. Now, I would never
Mhm.
squelch them from, if they wanted to join a travel soccer league or something like that, fine, I'll support them, whatever. But from an early age, we started doing things with them that we can do lifelong and together. So we
Yeah,
hike, we bike, we golf, we ski, we do things that we can continue to do so we can spend time, quality time together. And we've just made that a priority. My wife is actually a clinician. She works at the facility I work at. And so, another thing I've done is we had made a commitment to each other. We're not going to bring work home and
right.
we're not going to talk. Now, she doesn't report up through my lines either. So,
Yeah,
that it makes it a little easier, but we need to keep that separate. And so
yeah,
I can be present here for my family when I'm here and, at work when I'm at work. The other is I've, honestly sought, again, outside help to support my stress management. And
yeah.
I actively, I exercise regularly as well, just to
Mhm.
make sure that I can unwind and make sure my family stays a priority when I'm with my family. Another trick I learned, and I don't even remember where I learned it, but and it kind of goes along with where we chose to live. Um, I try to make sure I've got enough distance between home and work so I can truly unwind at the end of the day
Mhm.
and gear up at the beginning of the day. So I'm not already working. I know I hear a lot of people say this, their alarm will go off. The first thing they do is they look at their phone and go down through their emails. So nope, I don't look at email until I'm in the office.
Wow.
So I need that time to kind of spin up so I can be present for my family in the morning and wind down when I can get home with them at night. I also learned this tip. I always try to live east of where I work,
Okay.
especially in a rural community. The reason is I'll have the sun at my back in the morning and the sun at my
Mhm.
back going home. I can see the animals. So, and it doesn't give me a headache staring, that glare. You can see people driving
Yeah.
like this. So, yeah, so it's worked out that way, but I always try to do that too.
Oh, wow. Well, thank you so much. I have truly enjoyed my time with you. I learned so much about you that I did not know. And so I really cherish the time that you have committed to us today to share your career journey. So thank you. And thank you for tolerating the nonsense.
Absolutely. Thank you, Dr. Love. I really appreciate being invited to share this, and I hope somebody got anything out of this at all. But
Yeah,
it's always a great refresher and a reminder to me is, why I'm doing this in the first place.
that's
So thank you for giving the opportunity to share. I appreciate
right.
it.
Thank you for your service.
Okay. Have a
Take care.
great evening.
You too. Bye.